CNA Parkinson's gait queuing. Welcome to the quiz. Question 1. You are assisting a resident who uses a cane to walk. The resident is unsteady. Where should you position yourself to ensure maximum safety? Option A. On the resident's stronger side, holding their arm to provide support and guidance. Option B. Directly in front of the resident, walking backward and watching their feet to ensure proper placement. Option C. Directly behind the resident, with your hands on their hips, ready to catch them if they fall backward. Option D. On the resident's weaker side, approximately one step behind them, and hold the gait belt securely at their back. This allows you to support them if they start to fall without impeding the cane's use on the stronger side. The answer is D. Positioning on the weaker side provides support where it's most needed. Option A is incorrect because supporting the strong side may not prevent a fall to the weak side. Option B is incorrect because walking backward is awkward and you can't see behind you. Option C is incorrect because being behind does not allow you to catch a forward fall. Option D is correct because standing on the weaker side allows you to support the side most likely to give way, and holding the gait belt gives you control. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 2. A resident with a gastrostomy tube, PG tube, is receiving a tube feeding. The resident begins to vomit. What is your immediate action? Option A. Slow the feeding rate down by half and continue to monitor the resident for further vomiting. Option B. Stop the feeding immediately by clamping or holding the tubing and turn the resident onto their side to prevent aspiration. Then, call the nurse immediately. Option C. Continue the feeding, as vomiting can be a side effect of tube feeding, and it will likely pass. Raise the head of the bed higher. Option D. Call the nurse to see if you should continue the feeding or stop it, while continuing to observe the resident. The answer is B. Stopping the feeding and positioning to prevent aspiration is critical. Option A is incorrect because slowing may not prevent aspiration if vomiting occurs. Option B is correct because stopping the feeding prevents more formula from entering the stomach, and turning the resident on their side helps drain vomit and prevent aspiration. Option C is incorrect because continuing the feeding can worsen vomiting and aspiration risk. Option D is incorrect because waiting to call the nurse delays critical action. Question 3. You notice that a coworker is frequently short-tempered with a particular resident who has dementia, sometimes rushing their care and speaking to them in a harsh, scolding tone. What is your responsibility in this situation? Option A. Report your observations to the nurse manager or charge nurse privately, as this could be a sign of psychological abuse or neglect, and the resident deserves to be protected. Document what you have seen. Option B. Confront the coworker in front of the resident to defend the resident and tell them their behavior is unacceptable. Option C. Ignore it, as it's not your place to correct a coworker and you don't want to create conflict on the unit. Option D. Talk to other CNAs to see if they've noticed the same thing before taking any action to confirm your suspicions. The answer is A. Mandated reporters must report suspected abuse to a supervisor. Option A is correct because as a mandated reporter, you must report suspected abuse or neglect to a supervisor. Option B is incorrect because confronting in front of the resident can escalate and is not the proper chain of command. Option C is incorrect because ignoring allows potential abuse to continue. Option D is incorrect because discussing with others first may be gossip and delays reporting. Question 4. Which of the following is an example of a complete, accurate, and objective CNA charting entry? Option A. Resident seemed very sad and depressed during AM care. She barely ate anything. Option B. Resident's blood pressure was sky-high this morning. Probably forgot her meds. Option C. Resident was in a bad mood today and refused to get out of bed. Option D. 9 a.m. Resident assisted with bed bath. Skin on sacrum and heels intact, no redness. Tolerated procedure well without SB. Encouraged to drink, took 240 milliliters of orange juice. Output 300 milliliters clear yellow urine at 8:30 a.m. The answer is D. Objective charting includes specific, factual observations without opinions. Option A is incorrect because seemed sad is subjective. Option B is incorrect because sky high is subjective and probably forgot meds is an assumption. Option C is incorrect because bad mood is subjective. Option D is correct because it includes specific, factual observations without opinions or interpretations. Question 5. A resident has an order for up-in chair with assistance for all meals. What does this order specifically require you to do? Option A, you must provide the level of help the resident needs to safely get into the chair for breakfast, lunch, and dinner every day. This is a non-negotiable part of their care plan. Option B, the resident can get up whenever they want for meals, but you must be available to help if asked. Option C, you should ask the resident each day if they want to get up for meals, as they have the right to choose. Option D, the resident must be in a chair, not in bed, for all meals, but they can get there by themselves. You only need to supervise. The answer is A. The order specifies a required intervention at each meal. Option A is correct because the order specifies with assistance and all meals, meaning it is a required intervention at each meal. Option B is incorrect because it's not optional. Option C is incorrect because the order is not optional based on the resident's daily preference. Option D is incorrect because it requires assistance, not just supervision. Question 6. The family of a resident asks you for a specific medical diagnosis and prognosis. You do not have this information in the care plan. What is the best response? Option A, go find the resident's chart and look up the information for them so you can provide an accurate answer. Option B, I'm not authorized to give out that information. You'll need to speak with the nurse or the doctor about specific medical questions. I can let the nurse know you would like to speak with them. Option C, tell them what you have personally observed about the resident's condition, such as their appetite and mobility, to be helpful. Option D, give them your best guess based on your experience with other residents who have similar symptoms. The answer is B. CNAs cannot provide medical information. Referring to the nurse is appropriate. Option A is incorrect because accessing the chart without authorization is a breach of confidentiality. Option B is correct because CNAs cannot provide medical information or diagnosis. That is the nurse's or doctor's role. Option C is incorrect because sharing observations may be misinterpreted as medical advice. Option D is incorrect because guessing is unethical and could be harmful. Great job! Don't forget to subscribe. Bye!